welcome back to our channel Dentistry to the Point. This is Dr. Drumil Manik, and in this video we're going to discuss about how I'm going to resume or restart your dental practice after this lockdown ends. I hope this ends on 31st of May and it is not extended further, right? So in this COVID-19 pandemic situations, there are higher chances of cross infection to the dentist as well as the patient who is receiving the dental treatment, because many dental procedures which we do requires close contact with the oral cavity, blood, saliva, and also sometimes the respiratory tract secretions. So to reduce and avoid the chances of cross infections, there are various guidelines which are to be followed by each and every dentist. I have tried to make this as simple as easy for you to understand, and in between I'll also pop out some video demonstrations so that you can get a better idea about which are the armamentarium and which are the protocols which are to be followed, right? So before starting with the video, I would like to thank each and every one of you for providing the valuable time and watching my video. Now, as we all know that saliva is going to be rich in the COVID-19 viral load, so there are chances that many patients who are visiting your clinic may be the carriers, but they're not having any signs and symptoms. So it is very much necessary to avoid such patients, and or if they are coming and you're not aware of it, then you should follow this protocol to avoid the cross infections, right? So as you know that various parts of the cities of countries are divided into various zones, that is the containment zone, red zone, orange zone and green zone, right? And according to that, they are given the permission to conduct the dental treatment. So in containment zone, only teletriage is advisable. That means you can consult the patient on voice call or video call, whichever is feasible. But if the patient is in such an emergency condition that it cannot be controlled by any medication or any other way, then he can seek for an ambulance and visit his nearest dental clinic or hospital. Now discussing about the red zone, in the red zone only emergency dental procedures are allowed, and in orange and green zone you can do both emergency and urgent dental procedures. Now you guys might be a bit confused now which are the emergency and which are the urgent dental procedures. So now we'll see a chart which describes the various emergency and urgent dental procedures which are to be followed in this situation. So now as you guys have seen the various procedures which fall under the category of emergency and urgent dental procedures, apart from this there are also various changes which you need to make in your dental practice before starting it, right? So for this we'll divide it into three phases. इसको अपन तीन phase में देखेंगे. First will be your preparatory phase, second will be your implementation phase, and third will be your follow-up phase. So preparatory phase में आप क्या करोगे? There are going to be some preparations which you need to make in your clinic. आपकी क्लिनिक पे कुछ preparations आपको करना पड़ेगी. Second will be your implementation phase, मतलब कुछ चीजें रहेगी जो आपको compulsory implement करना है. And third will be your follow-up phase. So starting with the preparatory phase. So the preparatory phase comprises of doctor and healthcare prophylaxis against COVID-19. मतलब जो भी doctors or healthcare workers hai who are going to start their clinic, they need to get themselves checked up for COVID-19. If they're asymptomatic and don't fall under the area which has the COVID-19 patients, then it is not necessary to get themselves checked up, right? Second will be your dental clinic's ventilation and quality, air quality management, right? Third will be your clinic entrance changes you need to make in clinic entrance, reception, waiting area. Then you need to have changing room for yourselves and your staff. Then will be dedicated area for sterilization. आपको एक dedicated area चाहिए for instrument sterilization and your sterilization of surgical clothes, then training for healthcare workers or nursing staff. आपके पास जो भी हेल्थ केयर वर्कर्स या नर्सिंग स्टाफ काम करेगा उनकी भी आपको 2 या 3 दिन ट्रेनिंग करना पड़ेगी. यू नीड टू रिहर्स फर्स्ट, then hand hygiene which you need to follow, then donning and doffing of PPE kits, because PPE kits are going to play a major role in your practice now. Use of N95 mask, and lastly the disinfection of clinic when you are going to leave every day, right? So this was all about the preparatory phase. Then we will have implementation phase. Implementation phase में क्या रहेगा? Teleconsult and tele screening. You firstly, whenever you contact the patient, the first contact which you make with the patient will be through telephone, right? And telescreening, you need to evaluate all the past medical history, all the symptoms which are related to COVID-19. Then only you're going to allow the patient to visit your clinic. You can design and consent form which you can send it to the patient through email or any other format. He needs to fill up that form and again send it back to you, the consent form and the disclaimer form. Then you need to have what can the patient do before arriving the clinic. What are the protocols or guidelines or the instructions which the patient has to follow before arriving the clinic. Then patient discharge protocol. Then what are the guidelines which you need to maintain while doing the procedures. Then lastly, protocols for the clinic closure. When you are going to leave your clinic at the end of the day, then what are the protocols or the things which you need to do before leaving the clinic. And lastly, protocols for the healthcare workers or nursing staff. And lastly, third will be your follow-up phase, in which you are going to follow up and review the patients, right? So we discuss about all the headings, but we are not going to discuss in this order. I have a stepwise manner in which the patient is going to call you, is going to consult you, he'll reach your clinic, then you will do his OPD or examination. Then if or any necessary procedure has to be done, then you will do. So this will be in stepwise instruction so that you cannot get confused and mismatched with the guidelines. I hope you guys enjoy the video further. So starting with the step 1. Now the step 1 can have 2 scenarios. In the first case, the patient is going to call you. That means he or she is already having your contact number and or has visited your clinic before. In the second scenario, the patient is going to directly arrive at your clinic without informing you, right? So in both the cases, the protocols and the guidelines are going to remain almost the same. There will be slight change in the second case because you're going to directly meet the patient in live. So there might be slight changes which I'm going to mention further. Discussing about the first scenario, that the patient is going to call you. So the first thing which you're going to evaluate is about his or her past medical history or current medical condition. जैसे कि उसको कोई signs and symptoms है like cough, fever, shortness of breath, sore throat or running nose. Any signs and symptoms which are going to indicate or point towards COVID-19, you should raise concern and postpone the treatment for 3 weeks, and also ask the patient to go to the nearest COVID-19 dedicated hospital and get himself or herself checked first, right? After all this is done, और अगर patient को कोई signs and symptoms नहीं है, then second you're going to ask the patient to fill the consent form. Consent form आप patient को through email भी भेज सकते हो और through any other portal, right? वो consent form patient has to fill and send it back to you with his or her thumb impression. After consent form is received, then you will ask the patient about his or her dental problem, कि उसको क्या problem है, क्या उसकी प्रॉब्लम इमरजेंसी या अर्जेंट डेंटल प्रोसीजर्स के अंदर कैटेगराइज होती है. If it is not necessary, then you can ask the patient to take the analgesics or any local measures related to his or her problem. और अगर कोई previously appointed patient है, before lockdown आपका कोई patient बाकी है and it is very much necessary to complete that procedure, then that patient is also have to follow the same protocols and then can be called to your clinic. अब second case पे आ जाते हैं. Second case में क्या था कि the patient is going to directly arrive at your clinic. So what can or what have the patient को क्या करना चाहिए clinic आने से पहले? Firstly, he has to minimize or eliminate the wearing of wristwatch, any hand or body jewelry, and carrying additional accessories like polythene, handbags or any such materials. Secondly, he has to wear mask, right? Mouth mask is very much important for each and every patient. Mouth mask जब भी patient को खोलना है when the doctor is doing any procedure or he or she is examining the patient, right? So these are the protocols which are to be followed. Whenever the patient reaches your area, he has to maintain the social distancing protocols. And if you are going to appoint a nursing staff to do all the previous medical history work and the consent form, then you have to train that staff for maintaining the social distancing protocol. Even the staff has to wear the surgical OT dress with separate shoes for the clinic. Along with that, the staff is going to ask about his or her past history, his dental problems, and then get the consent form signed and then inform you about the whole scenario. Then you are going to allow the patient to enter your clinic. So these are the protocols, and even the sanitizer facility should be available at the reception areas. All the patients should get their hands sanitized and also get the mouthwash done before getting themselves examined, right? So this was all about the initial protocols, that is the step 1. So now there are also various instructions which are followed by the nursing staff as well as the dentist who are going to reach the clinic, right? He or she has to first change his clothes which is wearing from the home. He has to wear the proper surgical OT dress and then enter the clinical area. After that, the surgical OT dress should be autoclaved and sterilized a day before. After wearing this, he has to do scrubbing, has to wash his hands with Dettol and betadine hand wash. After this is done, he has to wear a 2-layered mouth masks. That is, first he or she has to wear N95 mask. Above that, a surgical 3-ply mask has to be worn. Along with that, 2 pair of gloves has to be worn. These are the basic requisites which are to be followed both by the nursing staff and the dentist. Now there are some additional requisites which are to be followed by the dentist also. So the dentist have to wear the PPE kits, that is the personal protection equipment, whenever his or she is going to examine the patient or going to do any dental procedure, right? So the nursing staff can also help the dentist in scrubbing and also providing the necessary materials which are to be worn like mouth mask and gloves, and also help or assist the doctor in wearing the PPE kits, the goggles, the head caps, the surgical face shields. All the things have to be compulsory worn by the dentist to avoid cross contamination, right? So after all this is done, the dentist and the nursing staff are ready to enter the clinical area where they are going to examine and do the dental procedures. Now the doctor can also appoint an assistant dentist along with him so that he can write all the findings and assist the dentist during the dental procedure, right? Even the associate dentist has to follow the same protocols which are to be followed by the main doctor. Now there are various necessary changes which are to be made before you call the patient into the clinic and make him sit on the dental chair. There are various customizations to be made in the dental chair also, right? So firstly, you need to remove the spittle area or the basin part in the chair so that you are not allowing the patient to spit into that, and you have to directly collect all the waste material through suction, right? Along with that, you are going to spray whole the dental chair with 1% hypochlorite, which is going to be freshly prepared every day. After spraying the 1% hypochlorite, you need to allow at least a contact time of 10 to 15 minutes. After that, the whole chair is wiped with a clean, sterilized or autoclaved cloth. All the parts of dental chair like the seat, backrest, handrest, headrest, the lights, the light handle, the trolley, each and every part of the dental chair should be wiped thoroughly. And if you are not able to remove the spittle part, you can just cover that area with a drape so that the patient is not allowed or is not able to spit in that area, right? So now after all this is done, you also have to place a cleaned set or a autoclaved set of diagnostic instrument which are going to be used for the examination. Now this is the preparation which you have to do before the patient enters your clinic. Now we are going to ask the patient to enter the clinic. His advice not to touch anywhere without the permission of the doctor. All the belongings, the handbags, the polythenes, the case files should be left outside, right? Now the patient is going to enter the clinic and he has to directly sit onto the dental chair. After the patient is sat on the dental chair, he or she is advised to do gargle with 2% betadine, right? It is very much necessary to do gargle and it is a compulsory step. There are no excuses allowed. So after the gargle is done for 1 minute, again you are going to collect all the waste with the suction. Now the patient is ready for getting examined by the dentist. Now the dentist is going to arrive, examine the patient. The associate dentist is going to note all the findings. Now the patient is again asked to sit outside for a while. During that time the doctor has to remove the above pair of the second pair of the gloves which is worn and dispose that gloves. After that use sanitizer. Now the sanitization part is done. After that the patient is again called inside, discussed and explained about his or her problems, and if any necessary or emergency dental procedure is to be done, then the patient is explained about that also, and even any necessary investigations like OPG or radiographs are to be done, then they are conducted, right? So after all this is done, now suppose you have to do any emergency dental procedure, then the patient is explained about that, and if he or she is willing for that procedure, then you need to ask him or her to wait outside till the necessary arrangements are made for that procedure. Now this is till the patient examination is done. Now there are various changes to be made in the dental chair while if you want to do any specific dental procedure. So the changes are like you need to cover the whole dental chair with the drape. The whole dental chair should be covered with an autoclaved cloth. The basin or the spittle area is also covered. All the set of autoclaved instruments are to be placed, and only the dental or the dentist is going to work into the patient. A dental assistant can assist the dentist, but he or she has to stand a bit away, maintaining the social distancing protocol, and also help the dentist in providing necessary materials only, right? So after the procedure is done, all the instruments are going to be kept aside. They are going to be washed and sent for autoclaving and sterilization, and all the waste material is going to be disposed in the designated area. The patient is going to be sent outside and ask him to wait till the doctor arrives and explains him the necessary part of the treatment after the treatment is done. So now after the procedure is done, there are various instructions again to be followed by the nursing staff and the dentist. So we'll divide this into two. First, the instructions followed by the patient as well as the nursing staff, and in the second division we have the instructions followed by the dentist, right? So discussing about the first part, the patient drape will be removed by the assistant. The assistant has to remove the patient drape, and the patient is asked to perform a hand wash and guided out of the clinic towards the reception and handed back all his belongings along with his footwears, right? Then the procedures and the prescription is recorded only after the doffing of the PPE kit by the dentist. Next, after the patient leaves the treatment room, then the assistant will collect all the instruments immediately, rinse them with water to remove the organic matter above them, and again follow the sterilization protocol which are to be done with the instruments. All the 3-in-1 syringe, water outlet and handpiece water pipelines should be flushed with a disinfectant solution for 30 to 40 seconds. Next, आपने जो भी suction collect किया था in the water containers, they are also should be thoroughly washed with 1% sodium hypochlorite using a clean and cotton gauze piece, and then fill them again with fresh 0.1% sodium hypochlorite solution and again attach back with the dental chair. Then again next part is disinfecting the dental chair. Again you are going to spray 1% hypochlorite onto the various parts of the chair, allow the contact time and again clean the dental chair. So this is to be done by the assistant. So these are the instructions which are to be followed by the patient, dentist and the dental assistant after the procedure is done, right? And if or any impression is recorded, then it should be disinfected thoroughly. You can use Sidex for that before pouring and sending them to the laboratory, right? So this is the part which you need to remember. So this is all about the instructions done after the procedure. So there are various steps which you need to keep in mind while doffing of the PPE kit. So the first step in doffing of the PPE kit is that you need to remove the gloves. You need to specially take care that you are not going to contaminate your hands while removing the glove. Next is you are going to remove the face shield and the goggles which you have worn. Dispose the face shield if you have any droplets of blood over that, and also dispose the goggles. After removing the gloves, next you are removing the whole gown of the PPE kit. You are going to untie all the ties which you have tied before, or break them gently. After breaking them, starting from the shoulder till the bottom of the legs, remove the whole gown in a single go. After removing the gown, compress it and dispose it properly. After disposing the gown, next you are going to remove the mask. The mask is going to be contaminated from the front surface, so don't touch it from there. Just remove the straps of the mask, break them and dispose the mask. After all this is done, again you are going to wash the hands thoroughly with the hand wash and the betadine hand wash also. After this is done, you are going to exit the operatory area and change your surgical OT dress which you had worn before. After changing the dress, you can again sanitize your hand with the sanitizer and you can leave for your home. Now there are various steps again which are to be followed by the nursing staff. The nursing staff has to place all the surgical OT dress into the detergent. After placing them into the detergent for few minutes, then they are washed thoroughly and again placed for autoclaving, right? This is the preparation which is done for the next day, right? So after they are autoclaved and all the instruments and all the chairs are disinfected, lastly the floor of the clinic should be cleaned with a two-step disinfectant, that is first with the detergent and second with 1% sodium hypochlorite. Again, the contact time for 1% sodium hypochlorite on the floor of the clinic should be 10 minutes, right? You are going to start this from the corner of the clinic and till the exit door of the clinic. So it is unidirectional. Again, after all this is done, again the nursing staff also has to change their dress, wash them, place them for autoclaving and leave for their houses wearing again their mask and maintaining the social distancing protocol. Hope you guys have understood all the guidelines which I have mentioned, and if you have any doubt regarding this, I have also attached the PDF file of the guidelines which have been received from the IDA. So you will find that in the description box. I hope you guys enjoyed the video, and if you like the video then please like, share and subscribe our channel, and don't forget to hit the bell icon so that you get regular updates of such interesting videos. Thank you.